Good afternoon, and welcome back to the Oneida Nation Reservation. We're here for our Facebook Live update. We've had a few changes today. It's May 8th, and we've been doing this for about 13 sessions right now. We do want to let you know we're socially distanced here, and of course we have our masks, so we're practicing what we preach. Just gets a little difficult sometimes to maneuver with that mask on up and down and to make sure that I can access my notes correctly. Many of you are aware that the Oneida Business Committee has extended our declaration of public health emergency, which also is the Safer at Home, until June 11th. So that's going to give the Oneida Nation more time to work on recovery and do it in a careful manner and take into consideration all those things that are impacting the safety of our community. So as you know, it may take us a while to lift restrictions, but as we did, as I used the example, the golf course, we will be able to lift restrictions. We know every single time we go on Facebook Live, we get a few of the same questions about the casino. When is the casino going to open? And we have to assure you that they continue to work on that. We also have to be very mindful of our environment and the safety and the testing that occurs. Testing is a very important component of our decision making. So today we have Debbie Danforth and Michelle Myers that are going to address those things. Yesterday, the Oneida Nation received some of the delayed federal funding from the Coronavirus Relief Fund, CRF. The receipt of these funds has prompted a change in our schedule today. The COVID teams and the Oneida Business Committee need to assess the impact of receiving that funding. And until we have that, we really can't provide a current financial picture. However, we expect to be able to assess those things, look at them, and reschedule finance to be on the Facebook Live on Monday, May 18th. So that'll give us time to look at how that's impacting us. So as usual, we collect the questions as they come across at the end. Before we go to Debbie and Michelle, if you want to get a pencil and a paper out, I have a few things that we want to add today because of the situation at hand. We want to make sure that people have current information, that we are not always able to reach out to everybody that we can. But we're finding that Facebook Live has a pretty good viewing. And some of the things that I'd like you to take note of is women, infant, and children. Right now, that program, which is WIC, is accessible by phone. And they're encouraging families with infants and children under 5 to apply for the WIC program. Here's the phone number, 920-869-4829. And they're in there Monday through Friday answering the phones from 8 to 4:30. So they offer formula, food benefits, fully accessible for those who are also breastfeeding. There's food that they offer, plus farmers market checks when the farmers market opens later this year. So farmers market is looking at opening later this summer with new controls in place. They have not yet determined for sure how that will happen or if that will happen, but that's something we know there's a lot of questions coming across on that too. Unfortunately, some of the things that will not be happening this summer for 2020 is the Oneida Powwow has been canceled. Apple Fest has been canceled. The pool tournament that was supposed to happen as well, the Great Law Recital, the Indigenous Games, and the Gaming Anniversary Celebration have all been canceled this year. So we're sorry to say that. Sad news. Also, this might take people pretty hard too, is we're asking people postpone your rummage and garage sales. It's still a little too early to gather in these large groups, so they're asking residents to postpone their annual yard sales until perhaps later in the year to help prevent the spread of the COVID. And that's coming from Brown County Public Health, the De Pere Public Health, and Oneida Public Health offices. Here's some good news. May 12th, They're back. Simon's Burritos, Tuesdays and Thursdays at the Oneida One Stops. Also, they're returning coffee to the customers by service. So that means they will serve you the coffee. It's no longer self-service, but you'll have people right there waiting to wait on you and provide your coffee service. So that begins next Tuesday. Also, there's a request to ask for individual Oneida Nation enrolled members who are at least 18 to apply for alternate positions on the Oneida Election Board. They cannot be an employee of the Internal Audit, Finance Administration, or the Law Office. Because these are essential positions, stipends will be paid for the meetings and an hourly rate on the day of the election. So write this down if you're interested in getting onto the election board. OEB-VCOR@oneidanation.org. You can go to that website for the Oneida Nation as well and look under elections and look at more information that's available there. And before we get to our health update, I just want to point this out. This is something everybody should have received in the mail. It's 16 pages of a COVID report. This report was really condensed, but it takes into account what's been happening on the Oneida Nation reservation since the onset of this COVID-19 pandemic. It gives you a lot of information on what has been done. Not all the information, as I said, it's been condensed, but still, it's a pretty concise packet of all the work, all the people that have been working together to put this together have really, really been working hard to provide our tribal membership as well as the world with some insight into what has been done. So there's a lot of facts, a lot of information, as well as our COVID website, which is the orange banner at the top of the Oneida Nation government website. So just wanted to bring some of those things to your attention. There's a lot going on. There's still a lot to happen. We've got a long way to recovery. But we hope that you look at what has been accomplished and that you support some of the efforts that are ongoing and that you encourage everybody to continue to support recovery and to respect and recognize our declaration for safer at home as well as our public health emergency. So with that, talking a little bit about testing, I'd like to turn this over to Debbie Danforth.
Thank you, Bobby. Good afternoon. I want to just go ahead and start with just providing you an update on what's been going on the COVID-19 epidemic as of today from a global, a national, a state perspective, and our Northeast Wisconsin region throughout the Indian Health Service, and of course how it's impacting us here in Oneida. So as of this morning, the number of COVID-19 cases reported are as follows. Globally, we're about almost 3.9 million positive cases across the world and 270,000 deaths. Within the United States, we're about nearing 1.23 positive cases and over 75,000 deaths. Within the Indian Health Service, we're at 4,614 positive cases. The majority of those being, sadly, in the Navajo Nation, so keep them in your daily prayers. They are currently at 2,896 positive cases. In the Phoenix area, there's 430 positive cases. In the Albuquerque area, we're at 331 positive cases. In the Nashville area, we're at 212 positive cases. And within the Bemidji area, which is where we are, within Minnesota, Wisconsin, and Michigan, there are now 75 positive cases. For the state of Wisconsin, as of yesterday, there are 9,215 positives with 374 deaths. The hospitalizations for the state of Wisconsin are at 1,732, or approximately 19%. This is actually decreased from last week when the percentage was about 23% hospitalizations. For Brown County, we have 1,706 positives with 12 deaths. For Outagamie County, we have 93 positives with 2 deaths. For Oneida, as of this morning, we have a total of 18 cases in the Oneida Reservation. 8 cases are in Brown County, 10 cases are in Outagamie County, and we have no new cases to report as of right now. That can change throughout the day. We have been doing a lot of testing, which I want to go ahead and start giving you some information. Testing has actually improved our ability to obtain test kits from the state of Wisconsin, so we've actually been able to increase the amount of testing that we are doing. As of 4/29, we've been conducting our drive-through testing site on a daily basis, Monday through Friday, 8 to 4:30. Patients are required to contact their primary care provider through our triage nurses at the Oneida Community Health Center. Patients that call in will be assessed for their signs and symptoms and potential for risk for exposure. That information is then shared with their provider, and the provider then will determine if a test is appropriate and place the order for the test. Once that order is received, the triage nurse will then contact you back with an appointment time and provide you with instructions to report to the drive-through test site. Upon arrival to the test site, the patient is then going to be greeted by a screener who's going to ask you for identification, and they will confirm the appointment time that has been assigned to you. Once the confirmation takes place, then you'll be instructed to proceed to the testing, and instructions will then be provided to you in terms of how we will inform you of your results. Those will be given to you in writing. If the patient that comes to the test site does not have a confirmed appointment, then you will not be tested, and you will be asked to leave the test site and instructed on how to contact your primary provider. The basic reason that we have done that is that we just want to make sure that you have been properly assessed for your symptoms. And there are other testing site options available if you have not been established as a primary patient at the Oneida Health Center, and Michelle's going to cover some of that. The state of Wisconsin, via Governor Evers, issued a mandated order to begin testing all long-term care facilities throughout the state. That was to include the testing of employees and residents as well for each long-term care facility. We have been awaiting those orders. However, we have made the option to decide to go ahead and move forward with testing for our Anna John resident-centered care community. So yesterday we started testing all of our employees that work through the facility or work for the facility, and those individuals who were working were tested yesterday. So we did a total of 129 tests for just the employee base through the AJR-CCC. The 39 residents that reside at the AJR-CCC are being tested today, and we should have all of those results within a few days. The reason that was issued, that order was issued by the governor is because we have seen an increase in terms of positive cases of the virus within long-term care facilities, and so we wanted to be ahead of the game and not wait for those orders, so we took the initiative to begin that testing for ourselves. Within the health center, just want to update you. We have been monitoring everyone coming to the facility for services and or vendors. And so we have staff stationed at the doors who will ask you questions regarding how you're feeling, any potential exposure to the coronavirus, and we will check your temperature. Please do not be offended by this. We're monitoring everyone to keep everybody in the community safe. So we'll ask anyone entering to put a mask on if you do not have one when you enter, even if you're just picking up medications. This is to protect you and to protect the employees and to protect our community. We are running low on masks, so if you have your own cloth mask, we are asking you to please wear your cloth mask when you are coming to the health center. We have received donations from some of the community members, and we're very appreciative of those donations. So if we have any seamstresses or sewers in the community, we'll gladly accept more donations of cloth masks. So thank you. With this, I'll turn it over to Michelle Myers, who is our Public Health Officer.
Thank you, Debbie. To successfully stop the spread of a contagious illness such as COVID-19, it's important to implement a variety of prevention strategies. Some strategies encourage or require the community to change behavior. Several weeks ago, we increased communication to the community on the importance of washing your hands often and staying home when you're sick. When cases of COVID-19 illness were identified in the United States, we saw travel bans and guidance to quarantine those that had traveled. In order to protect some of our most vulnerable population, long-term care facilities restricted visitors and non-essential visits from the public. We began seeing states issuing safer at home orders to keep people home. This week, the United Nations extended the safer at home order through June 11th. And of course, recommendations for all to wear cloth coverings over your nose and mouth when you're in public for those essential errands such as grocery shopping, or as Debbie mentioned, going to see your medical provider. So some of the other strategies that are specific to individuals, particularly laboratory testing. This is an important strategy to slow the spread of COVID-19. But we need to know who is ill so that we can separate them from those that are well. COVID-19 is a novel virus. Simply put, this means it's new to everyone, and everyone is at risk to becoming ill all at the same time. And this puts an enormous strain on healthcare systems. Testing for COVID-19 had been limited. That meant testing was prioritized to certain groups or focus areas. Beginning this week, our testing capacity here in Brown County has increased. Earlier this week, Brown County opened 2 community COVID testing locations in Green Bay. One at the Rush Center on the west side, and another at Casa Alba on the east side. Symptomatic individuals who live or work in Brown County simply reserve a spot online. The website is www.stayhealthybc.com. Brown County 211 is also available to assist with just reserving those spots for you if you have questions. The hours of operation are from 8 a.m. to 6 p.m. Monday through Friday, and 10 a.m. to 3 p.m. on Saturday. There's no testing offered on Sunday, and then this testing will go on through next week. Currently, we define the following symptoms as qualifying for this free testing: fever, chills, cough, headache, sore throat, muscle aches, trouble breathing, runny nose, nausea, vomiting, diarrhea, stomach pain, loss of taste or smell, and fatigue. If you are experiencing these symptoms of COVID-19, the community testing sites may be an option for you. As of today, as I mentioned, the community testing sites will continue through next week. Thank you.
All right, thank you, Michelle. One of the comments and questions that are coming in is in regard to those who are in recovery. Apparently we don't always list how many of people we have in recovery. Debbie, can you maybe talk a little bit about those in recovery?
Sure. So for Oneida, in the reservation areas, we have 18 cases that have been counted as positive. That's 18 cases total. That means that 7 of those cases that we currently have in Outagamie are currently in isolation. So those are active cases that are being monitored. The other 11 cases, both in Brown and Outagamie County, are in various stages or completely recovered from the virus itself.
Okay, another question is anybody currently in the hospital that we're aware of in recovery?
As far as I know from the 18 that we have on reservation, I'm not sure if any of those individuals, I do know that there are tribal members that are in the hospital, but they're not being followed by us. They're followed by both Brown or Outagamie County.
And why aren't they being followed by us then?
The reason they're not being followed by us is they reside outside of the reservation boundaries. So if they live on the east side of Green Bay, they're not counted in our counts, but they are counted in the Brown or Outagamie County, depending on where they reside.
All right, I'm not quite sure. I know we have regulations in terms of HIPAA and other laws that we have to follow, but is there any way that we can speak to where these cases are on the reservation. I know there's a lot of concerns about, well, do they live in this area, in that area? And I know we have to protect individuals. Is there any way we can provide additional information about where the active cases are?
Well, right, Bobby, HIPAA is something that we have to be careful for. So the information that we talk about when it comes to the cases that we're following is just really what we're allowed to share. We need to protect the identity, and giving an address or a location that would be a challenge in that situation. But we do know that working with our law enforcement agencies, they are notified if there is any need for enhanced personal protection, if they would be called to say for an ambulance or police assistance. So the individuals that need to know that information for emergency responses do have that.
Okay, and then I know we mentioned this previously, the tracking as to where individuals have been. Can you say a little bit more about how important that is, so that those people who want to know where in the community these individuals are, if they are in your area, is that a part of the contact tracking that say, this was my neighbor? So maybe you come over and you tell me, we just want you to be aware. Is that part of that contact tracking?
Yes, we call that contact tracing, and
Tracing.
that's okay. That's part of the interview process when someone is confirmed to have the COVID disease. We interview them, public health interviews them, and collects information such as who have you been in contact with when you were infectious with this illness. And so what happens after that is we will contact those individuals that have been identified, and we will let them know in a confidential way that they may have been exposed to someone with COVID-19. And then depending on the level of interaction with, say, a contact, they may just be watching themselves for symptoms, they may be asked to stay home and watch themselves for symptoms, or they may need to quarantine at home. So it just depends on the type of interaction that they had with that positive case. Do you have anything else?
I just wanted to add that the level of contact, just because if Michelle tested positive and I walked past her at 3 o'clock in the afternoon, that's not considered a high-risk exposure. However, if Michelle and I sat face-to-face and ate lunch together for 3 weeks straight, every day, that might be considered a little bit more closer contact. And if my grandchild spends the night at my house every night for a week and I test positive, that's going to be considered a higher risk exposure.
Okay, thank you. Just a reminder out there that we're taking the questions that are germane to the individuals here who can answer the questions, the health-related questions. We're getting a lot of other questions that, if you send them in, we'll try to refer you to the appropriate resource for answers, but we can't answer questions on other areas that we don't have a representative here today for. So I do have another question about what are we doing for those, to be careful for our elders, our nursing home people, and those who are more vulnerable. And I know you mentioned a little bit earlier, but this individual may have tuned in a little later. If you could address that, Debbie,
Sure. One of the measures that we took back beginning of March for the nursing home, we went ahead and we, of course, those of you who participate in the congregate meal site, we made the decision that was in the best interest of all of our elders in the community and canceled that congregate meal site, because 100 people coming in, all in their, as elders coming in and sitting next to each other on a daily basis, was not what we wanted to see happen. We didn't want to see anybody in that category get sick. It would only take one person that was sick to come in, spread that disease to everybody, and then we would have had a lot more troubles than what we have now. The same thing goes for the Meals on Wheels. So we made some decisions with Elder Services to try and coordinate how we could deliver those meals to everybody, to avoid having everybody come in and come to the site and come into the nursing home. In addition to that, we took the measures before the state even made those recommendations to close the nursing home to all visitors. And the reason we did that was basically to protect the population of our elders that reside at the nursing home. We've also taken additional measures to avoid having anybody bringing in any kind of treats or things like that to the residents. We know that it's placed a great strain on the residents, and we're doing all that we can possibly do to keep their spirits up, to make sure that they're protected on a regular basis. But we have family members that would do the laundry for their loved one at the nursing home, and we have stopped that, basically because of the fact that it's a potential exposure to not only that resident but to all of the residents within the nursing home. So we've taken very, very tough measures to try and assure that we are protecting those individuals that reside at the nursing home. As far as our community members, we're trying to provide medication deliveries to those individuals that are 60 plus or have a high risk in terms of health disease or other steps that we can prevent them from having to come into the health center. We have had individuals that have had their health care services provided via phone, so that we don't have those individuals coming into the facility and their provider is reaching out to talk to them. So we've taken as many measures as we possibly can, and we're assuring that if they don't have masks, we can provide those masks through coming into the health center. They're issued a mask as they come in to assure that they're protected and that everyone is safe.
All right, thank you. At this time, we're finishing up here. I do want to say thank you for tuning in, and as I said, sometimes you hear the same things over and over, but we always have new people that come on and watch us every week. So continue to wear your masks, the social distancing, and stay safer at home. I come in before every segment and I use my bottle and I clean off all the surfaces and the chairs and make sure we are distanced apart. So I'm doing my part, and I realize that it does bother some people that I don't wear the mask, and I do apologize, but I make sure that we're very safe, very sanitized up here every week. I also want to say thank you for those people who have engaged in prayers and smudging on behalf of everybody. I have a lot of people in my prayers, and I hope that we can share that urgency to lift this from our community. We've been all home for a long time, and I know it's getting difficult. It's also very stressful. If you look on the COVID webpage, there's also individuals that you can contact in behavioral health for stress-related assistance and guidance. So, Yawonko to everybody, and I want to wish everybody a happy Mother's Day. Treat your mother special. Be good to your mother. Stay safe and be well. Gunulong kwaswa to all the mothers. Yawonko.